What is your plan for addressing the absurdly long wait times in hospital emergency wards and bed shortage? He says, my mother waited 3 days for a bed and the lack of extended care facilities. And he says there's a 1 year wait time. Well, Pat, that's a question that's close to my own heart because about 7 years ago, my father was taken to the emergency ward at the Rocky View Hospital in Calgary. And he had some kind of a viral infection. I happened to be in Vancouver that night. I wasn't around. My mom took him there, and he was checked into the emergency ward about 9 p.m. and sat in a chair in the admitting room of the emergency ward for over 12 hours. 9 a.m. the next morning, he still had not seen nobody had called him and hadn't seen anybody. One of my brothers was in town, heard about this, kind of went and raised heck at the hospital. Finally, by the early afternoon, he was getting some tests, but he died later that day before the test results had even come back. And so, we're talking, I think, roughly 15 hours unattended, untreated. I don't know, did that lead to his death or not? All I can tell you is if we were living in the United States, we probably would have sued the hospital and everybody involved, but we're just Canadian, so we just accepted it. And that's not right. Families like yours and mine, there are so many stories like this, and it makes no sense in what is one of the most expensive publicly funded healthcare systems in the world. Canada is at the top of the world in terms of health expenditures per capita for a publicly funded and administered system, and Alberta is at the top of Canada. So we have one of the most expensive public systems in the world. True, the U.S. is more expensive, but it's not a public system in this like ours is. And so where's the money going? Yeah. How can your mom wait for 3 days for a room? How can my father wait for 15 hours to see someone? It seems to me that over the past 3 decades or so, politicians have tried superficial solutions to the systemic problems of our healthcare system. They've gone from a decentralized system to a centralized system, to decentralize again and then re-centralizing again. And that every time that we go through this, effectively this organizational shell game, there's a new layer of bureaucracy and administration that never seems to go away. Now, I hear from frontline health professionals all the time, nurses, physicians, paramedics, and others, that there is enormous waste in the administrative functions of the health system, and an enormous amount of rationing of surgical rooms, rationing of supplies, rationing of staff time, and it simply isn't working. It seems to me the problem is not a lack of money. I mean, for goodness sakes, British Columbia spends about 20% less than we do on their healthcare system, and they have an older, on a per capita basis, they have an older population than we do, as compared to Alberta. And by rights, it should be more expensive in BC. But according to many of the key healthcare metrics or measurable outcomes, they do better than we do. So it seems to me that we need to push the resources and decision making to the greatest extent possible out to where they are used, to the front lines. We need to reduce the massive bureaucracy and administration that has grown up at the center of the system. And I also believe we need more internal competition. With a competition comes efficiency. We should also have more choices for patients and Albertans in how they get their health care. Quebec, for example, has far more choices available. They maintain, as we should and must, a publicly funded, universally accessible, single-payer system that ensures no one is denied access to timely health care because of their ability to pay. But beside that, they also have a lot of choices that cuts the wait time and the queues and demands for scarce resources in the public system. So I think we Albertans should have at least as many choices as Quebecers do.